The skeletal system, which is made up of bone, performs several basic functions. The skeleton serves as the structural framework of the body by supporting soft tissues like the skin and providing the attachment points for the tendons of most skeletal muscle. Bone protects our most important internal organs. For example, the skull protects the brain and the rib cage protects the heart and lungs. Most skeletal muscle attaches to bone, and when that muscle contracts, it will shorten and pull on a bone to create movement at a joint. Bone tissue stores several minerals, including most of the body's calcium and phosphorus stores. Within certain bones, red bone marrow produces red blood cells, white blood cells, and platelets. And within other bones, or in other regions of a bone, we find yellow bone marrow, which is a storage site for triglycerides or fat. Now, within the skeletal system, there are many different types of bone. These bones can be classified into 5 main types based on their shape. So our 5 main types include a long bone, flat bone, a regular bone, sesamoid bone, and a short bone. So our long bone has a length greater than its width. Examples of a long bone include the femur, which is your thigh bone, which is the largest bone in the body, as well as the relatively shorter bones of the fingers and the toes. Long bones function to support the weight of the body and to also facilitate movement in conjunction with our skeletal muscle. Flat bones are generally quite thin and are composed of nearly 2 parallel layers of compact bone, enclosing a layer of spongy bone. Flat bones provide protection for the organs or the tissues underneath them, as well as a large surface area for the attachment of muscle. Examples of flat bones include the bones of the skull, the sternum and the rib cage, and also the bones of the pelvis. Irregular bones, as their name suggests, have an irregular shape. They don't fit into any of the other categories. And they often have a complex shape which helps protect an internal organ or tissue. So for example, our vertebra, which are the irregular shaped bones of the spine, they surround and protect our spinal cord. Sesamoid bones are bones which develop in tendons where there is considerable friction, tension, and physical stress. Functionally, our sesamoid bones protect the tendons from excessive wear and tear, and they can also often change the direction of the pull of a tendon, which can help improve the mechanical advantage at a joint, so make that joint more effective. Examples of sesamoid bones include the small round bones found in the hands and the feet. However, the most common and well-known sesamoid bone is your patella, which is the bone which forms your kneecap. Lastly, our short bones are somewhat cube-shaped. They're nearly equal in length and width. They consist of spongy bone tissue, except at the surface, which is a very thin layer of compact tissue. When located together, short bones provide stability and a small degree of movement. The carpal bones in your wrist and the tarsal bones in your ankles and feet are all examples of short bones. So recapping that all in text for you, our long bones are longer than they are wide. They support the weight of the body and facilitate movement in conjunction with muscle. Our flat bones are flat, funnily enough. They serve to protect the tissues underneath and serve as a large attachment site for muscle. Our irregular bones are irregular complex shapes. They also often serve as protection for internal organs. Sesamoid bones are embedded in a tendon. They protect that tendon from wear and tear. Short bones are about as long as they are wide. They provide stability and a small degree of movement. Now, of those different bone types, long bones play a particularly important role because they contain both red and yellow bone marrow, and they facilitate much of the movement of the body through their attachment to muscle. So learning objective number 3 is to describe the structure and function of each part of a long bone. So here is a long bone, remembering a long bone is longer than it is wide. And a typical long bone is made up of a diaphysis, which is the bone's body or shaft. It's this long cylindrical section here. And then 2 epiphyses, which are the proximal epiphysis and the distal epiphysis, or the 2 ends of the bone. Which end of the bone is proximal or distal will depend on which end is closer to the point of attachment. So this bone here is our humerus. This end here will attach into our shoulder. This will attach into our elbow. So this is proximal, it's closer to that point of attachment being the shoulder. This end is distal because it's further away. We then have metaphyses, which are actually not labelled here, and I don't particularly need you to be able to identify these, but the metaphyses are the regions of bone between the diaphyses and the epiphyses. In growing bone, each metaphyses contains an epiphyseal plate, which is a layer of hyaline cartilage which allows the bone to grow in length. So that's why this region is important. Now, we will cover bone growth later on in this series of lecture recordings, but when a bone stops growing in length, which is typically between the ages of 14 and 24, the cartilage in that epiphyseal plate is replaced by bone, and that resulting layer of bone is known as the epiphyseal line. We then have articular cartilage, which is found at either end of a long bone. The articular cartilage is a thin layer of hyaline cartilage which covers that epiphysis and is called articular cartilage because it's found where 2 bones will articulate or meet. The function of this articular cartilage is to reduce friction and absorb a small amount of shock at a freely movable joint. So if this section here is where your humerus will meet the 2 bones of your lower arm, this layer of articular cartilage will reduce the friction between those bones as you move your elbow. Now, surrounding the bone, we have the periosteum. Peri means around, and remember, ost refers to bone. So this is the layer of tough connective tissue which surrounds the entirety of the bone except for where we find articular cartilage. It's composed of an outer fibrous layer and an inner osteogenic layer, which consists of cells which allow the bone to grow. Aside from containing cells which help the bone to grow, the periosteum also serves to protect the bone, nourish underlying bone tissue, and also serve as an attachment site for both ligaments, which connect bone to bone, and tendons, which connect muscle to bone. The end ostium is then the thin membrane that lines the inner surface of the bone. So endo refers to within, ost again referring to bone. The endosteum contains a single layer of bone-forming cells and a small amount of connective tissue. Lastly, we have the medullary cavity, which is a hollow cylindrical space within the diaphyses of the bone. This area contains fatty yellow bone marrow and many blood vessels. Aside from storing that yellow bone marrow, this cavity also reduces the weight of a long bone by reducing bone density where it's least required. Now, we also have compact bone and spongy bone labelled on this image here. We're going to speak more about these two types of bone tissue more shortly, but I just wanted to highlight here that the different types of bone are found in different regions. So our compact bone is found all the way along the outside of a bone. So you can see it's that thick tissue here, and then thinner around the edges. Our spongy bone is this spongy looking tissue. It looks like a kitchen sponge that's found on either end.